scapular pelvis combination.
Okay, so move back to me a little bit. Okay. Okay, so I would tell my patient, remember that we did a pattern over here where you brought your arm down and forward, okay? And we did a pattern here where you brought your hips up and forward, okay? So what we're gonna do is we're gonna do that first. We're gonna do the shoulder blade. While you're holding the shoulder blade, you're gonna add the hip. And then we're gonna do them both at the same time, okay? So bring your shoulder blade. Now I'm doing a one-handed technique. Bring your shoulder blade down and forward. Right, now bring your hip up and forward and release. Okay, so that's what it feels like. Now do them both at the same time. And I'm doing a stretch. Okay, I'm giving him resistance. Hold it. And when he's holding it, I'm gonna let go for a minute. When he's holding it, I'm not pulling him back this way. I'm pulling him into scapula posterior elevation and hip or pelvis posterior depression. So I'm pulling. So he's coming in like this, and I'm pulling him out like that. Okay. So relax for a minute, and I'm gonna take him from a stretched position. Okay. Bring your shoulder and your hips together. Bring them together, bring them together, bring them together, bring them together, bring them together. Hold it there. Okay, so I'm trying to open him up. Okay, come back. And again, bring them together, bring them together, bring them together, bring them together, hold. And now I'm gonna let go. And now bring this shoulder blade up and back. And the hip, this hip down and back, and hold them. So, okay, now bring them together. Together, 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 together. Keep coming together more. And then open. Open yourself up. Yeah. And so sometimes we say, make yourself small, curl into a ball. Curl, 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 and make yourself big. And make yourself small. And make yourself big. Okay, so that gets a pretty good abdominal workout.
Yes.
And you could do that for either side. Okay. So, I mean, you talk about core stability exercises, okay? It's not just doing pelvic tilts, etc. You can do a good hands-on core stability this way. And let's take it a little bit further. Roll halfway onto your back. All right, let's stay close to me. Okay. Okay, you can do the same thing. Make yourself small. Come on.
Oh, wow.
And now make yourself tall. You see how I have to come down here? Make yourself small. Okay. Think your football players would appreciate this?
Yeah.
And they look at me and they say, ah, she can't make me work. Okay. So this is really good for rolling, okay? So if we take this not to a football player, but to someone who is maybe hemiplegic, okay? So I might position them here, and then let me roll you back. Okay, and this is his plegic side, and we know that this is hard to roll onto the good side, onto the stronger side. So I want your head to come down to your hip, your underside hip, and then roll, 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 and then come back. Come back, come back, look to me, look to me, look to me, and then come forward. Go. Okay, so you can start somebody rolling just from this position once you've done the scapular patterns. Okay? Good. Okay, thank you. I've had enough of a workout for today.
So we aiming for a flexion of the spine, not just the scapular motion.
Yeah, we're aiming for curl and open. Make yourself small, make yourself tall. Okay? You have to be sure that that kind of flexion is not contraindicated or precaution. So somebody who's just had spinal surgery, I don't think so. Okay, somebody who maybe has severe osteoporosis, maybe not. But for your average patient, maybe this is good, okay? You may not want to have them hold their breath when they're doing this, so you may add exhale as you're coming forward, okay? These are all the clinical niceties that depend on your patient. Okay, anything you want to add to that?
Yes. So in our last class, guys, remember we had one group which was trying to demo rolling in the bed, and we suggested how to facilitate it. So I put 2 pillows behind the patient so that they're able to roll it, and we did resistance with the patient so that they can learn. So in the beginning, what Dr. Sofer showed that Charles had a good control to balance himself and maintain his half-rolled position. But your hemiplegic patients may not have that control. So you can use the pillows and use the same strategy to train them for rolling. So it's the same principles, but think of how you can facilitate their motion. PNF is all about facilitating it. Don't make it so hard for them that they're like, oh, too much for me. So facilitation, use pillows, practice that. So think of that video. If you haven't seen it, you were not in that group who saw that video, go back, look at those nice 7 videos. They have different components of what you can learn from.
Okay.
The hemiplegic getting out of bed.
Okay, so we're not gonna practice that. You can put that together on your own, okay? Because that would be way too much fun and we have to continue. Okay, so we have like 3 more things that we need to do. We need to do upper extremity patterns and lower extremity patterns, and we need to do chops and lifts. So we're gonna start with the upper extremity pattern, and then we're gonna go on to chops and lifts, and then end with whatever we can with lower extremity, okay? So,